Hi, my name is Kirsten Hansen. My intended audience is members of the community and surrounding rural areas who are interested in learning about community resources for helping those they care about with mental illnesses and basically local community members. Spin it around on yourself. This is part of my actual audience. Okay. And so here I go. Crisis. There are all kinds of crises, from what kind of progress am I going to get, and to grandma broke her hip, and what do we do, and everything in between. But many of us will face a mental health crisis at some point in our lives. Who will be there when that happens, and how will it be handled? Community mobile outreach services, they're popping up all over the United States, and they reduce the likelihood that a consumer in crisis will be incarcerated, and they increase access to mental health services during and after the episode. As reported by the National Institute of Mental Health, mental illnesses are common in the United States, affecting tens of millions of people each year. In fact, 1 in 5 people will have a mental illness, and even those without a diagnosed mental illness may experience a mental health issue due to life situations or extreme stress. These statistics show that many of you may be exposed to a mental health crisis, either yourself or through somebody that you love. And how will that crisis be handled, and who will be there to intervene? Our local mobile outreach safety team, also known as MOST, pairs clinical social workers with police officers who respond to psychiatric emergencies to improve crisis intervention care, reduce the imprisonment of locally mentally ill citizens, and provide follow-up care and referrals to community services. This is according to their own website. According to a data collection examination done in the U.S., reported in the Journal of Mental Health, police officers respond to a large percentage of calls from people who are experiencing a mental health crisis. And they've been implementing mental health education for their officers in response to this common problem. Leaders in the mental health community and proponents of better care for the mentally ill have been a driving force behind the creation and implementation of these types of programs, the mobile crisis intervention programs. Police departments realized that they would benefit from being informed and educated about mental illnesses and the effects that these illnesses have on individuals' behavior and how they can best respond to situations to de-escalate them. Their main goal is to find supportive services for the consumer and hopefully keep them out of incarceration. According to a systematic peer review of mobile responder units found in the Journal of Psychiatry, it's reported that as many as 50% of people who call for crisis intervention, like call 911 or call for first responders, have previously been treated by psychiatric professionals, and that a large number of the police responders' calls are to mental health related situations. This shows that the need for these services is great, and the officers spend a lot of time on mental health related calls. The mobile crisis units provide a new and more preferable level of care for the consumers than police responders did in the past. According to a peer-reviewed report in the Mental Health Journal, these specially trained officers and clinical social workers help the consumers to, quote, feel safe, supported, and recognized as being in crisis rather than being labeled a criminal. The benefits of the mobile units include raising awareness, improving de-escalation techniques, and diverting consumers away from packed emergency rooms and the criminal justice system. Jails and prisons across America are full, and a large majority of the inmates have been diagnosed with some type of mental illness. Mental health police triage was created in response to this issue. In the past, before police staff were educated on mental illnesses and how best to de-escalate the situations, many consumers were taken straight to jail. J.D. Bloom from the School of Medicine in the Department of Psychiatry in Oregon published a peer-reviewed synopsis of mental health care in the United States. He demonstrated how today, compared to in the past, we have less institutions and less beds for people who are suffering from mental illnesses. He also showed in his study that the rate of incarceration has largely increased over time. So he compared this to the large rate of incarceration and the low number of beds for institutionalization, and says that this has resulted in a large-scale criminalization of the mentally ill. And these types of findings led to the new model of the MOST team. The National Commission on Correctional Health Care reported that in 2006, there were at least 341,000 incarcerated persons with severe mental illness in the United States. This represents approximately 15% of all the people who are in jail in a given year. This number is way too high. The likelihood that these people are getting the medications they need and receiving proper treatment in jail is very low. The police are working to prevent incarceration, but another benefit of these programs is to cut down on jail recidivism. So people who have been to jail before, and hopefully we can keep them from going back again and again and again. When the MOST providers intervene and are able to keep the consumer from being incarcerated, they have a chance to make a positive difference. The consumer may be assigned a social worker, given access to mental health resources, and receive follow-up care. It may be necessary to take them to the hospital or a mental health facility, but once stable and released, they may work with a therapist and a social worker or doctor to continue their treatment as referred by the MOST team. Again, they will be receiving much better care than they could have in jail. The MOST team will also follow up with the consumer after the initial crisis and check in with them to make sure they are receiving adequate care and complying with their doctors to avoid ending up in crisis again. So just to recap, the mobile intervention units have changed the way consumers are treated during crisis. The police force has a new set of tools at their disposal, and they've been able to reduce incarceration rates, and consumers are more likely to receive proper medical care and be connected with services to address their mental health concerns. The MOST team is an asset to the police department and to our community. They might not always know that an emergency call is mental health related, so it's important for consumers to know that these services exist. If you or someone you care about experience a crisis, you can call 911 and hopefully be treated with respect and connected with resources instead of receiving jail time, unless it's absolutely necessary. So ask for the MOST team in your city. Thank you.